So we're supposed to practice evidence-based medicine, but what I find most of my colleagues practicing is what I'd like to call expert opinion medicine. Okay, so they take the expert opinion of FDA Advisory Panel, and they say that's gospel. And we all know that that's very flawed science. In fact, they've excluded any evidence pretty much that could support low carbohydrate diets from their consideration. There are more and more doctors finding low carb. I'm in a group of about 200 doctors that we communicate by email in a Google group, and we talk about the latest research in low carb. And I'm also a member of the Association of Metabolic Healthcare Practitioners. It was really started by Low Carb USA. Low carbohydrate medicine is gaining in respectability and prominence around the country, but I'd say it's exploding with, the Virta program now is available in the VA. It's a low carb program. United Healthcare, which has something, they insure something like 24 million Americans for their health, has started a kind of a copycat program of Virta called Level 2. Virta published a paper showing that when people went on their low carb diet, the insurance companies could save $10,000 a year in medication costs alone. 90% of them got off all their insulin and other medicines except for metformin, which is very, very inexpensive. And they have their A1Cs drop below 6.5, which is the cutoff for diabetes. The insurance companies are very interested because they're beginning to realize that they can save a whole lot of money if they can get people to go on low carbohydrate diets. One of the approaches that the Level 2 that's sponsored by United Health Insurance, that they're giving their participants in that program continuous glucose monitors to use. And they tell them to be particularly aware of what the levels are an hour or two after they eat, because that can teach them which foods that they're eating are raising their blood sugar. And so it's a great educational tool. I like to use it myself in my patients if they're having trouble on their low carb diets and not getting the weight loss they want, or the lowering of their hemoglobin A1C number, the number that represents how your blood sugars have been over the last 90 days. If they're not getting enough progress on that, then I will often prescribe them a continuous glucose monitor and tell them just to take a picture of everything they're eating. And so that after the 2 weeks when they get their report, they can look at the spikes and then go back and look at the pictures on their camera and find out what foods were raising their sugars.
Annotated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.